Thank you, Madam Chair. This evening, we stand just before a day tomorrow of great political drama. I am trained as an engineer and not much of an expert on drama or plays, but I have at least one theory about acting in plays and drama, and that is usually it's very good or very bad. The question tonight, as we take a look at the drama that faces people who will be watching tomorrow, is what drama are they liable to watch? Are they going to watch the Olympics, the last part of the Olympics, a very exciting, or the political drama of 6 hours of discussion or debate, but I think it's more drama, that will take place tomorrow on the health care bill. Now, we have been talking about this health care bill for more than a year, and the subject has a tendency to get a little bit stale, but tomorrow is an attempt to revive that discussion. Now, one of the things that's required in good drama is that the theme or the major topic and the different parts of that drama have to be believable. And I think that's one of the things that may make the drama tomorrow more difficult in terms of its success. And let's just talk about what really is believable. The President claimed about a year or so ago, I guess it was in a State of the Union message, that this new health care was going to save money. It wouldn't cost us a dime. Well, I guess that's true. It's going to cost more like $1 trillion. Is that believable? The President repeatedly said that Republicans had no ideas, and yet at Baltimore, just a month or two ago, he said not that the Republicans had no ideas, but that he'd read the good number of bills that had been introduced by Republicans. Is that believable? The President also pledged transparency and openness in the whole process of developing a health care bill. What we've seen has been that bills are developed behind closed doors, and for tomorrow, the bill that has been created behind closed doors is going to be revealed only for 24 hours. And so, is the transparency openness pledge believable? The President in Baltimore talked about the fact that he had a lot of economic experts scoring the bill and taking a look at whether it works financially or not, whether or not the different component parts come together and it achieves the economic results that he wanted. And yet the Congressional Budget Office, which is supposedly and to a large degree politically neutral, when they scored the bill, they said that the Republican bill actually reduces premiums by 10%, while the Democrat bill makes them more expensive. And then there is a question about whether or not the meeting tomorrow, which is attempting to be billed as bipartisan and bipartisanship, does that really make sense? Because if you write a bill behind closed doors, unveiling it at the last minute within 24 hours, and then you demand that the Republicans agree to it, is that really bipartisanship? I wonder if that is believable. The President promised us that the bill that he was going to present when he was in Baltimore, that it included tort reform. And yet the bill that we've seen did the exact opposite. The states that had already enacted tort reform were forbidden from using those tort reform laws, so in effect it would reverse tort reform and go the exact opposite direction. Is that believable? We were told that the special deals have been taken out, and yet in a few minutes we will take a look at those special deals that remain in the bill. And then, last of all, and the one that I find most amazing is that the Republicans are obstructionists. I find that hard to believe how anybody could even repeat that, let alone believe it. I wish it were true. I sorely wish it were true. But the Republicans here in this chamber, my Republican colleagues, are 40 votes short of a majority. There is nothing that we could obstruct if our lives depended on it. The Democrats could lose 20 voters and still pass anything that they choose to pass. So how we could be, as Republicans, obstructionists, again, seems to be very hard to pass the old sniff test. Now, it seems that the President, in setting up this great drama, 6 hours of televised discussion on health care, has made a major assumption, and that is if people just knew what was in his bill, they would really like it.